Hey guys, this is Dr. Hub. Today we'll look at the examples of the type 4 for hypersensitivity. So they include, there is a tuberculin test, then comes the leptoma test, there is also the multiple sclerosis, chronic graft rejection, then the contact dermatitis, there is also the sarcoidosis, then there is primary biliary cirrhosis, then comes the type 1 lepta reactions, and also the Crohn's disease and the psoriasis. Now let's look at the mechanism, how it's working. So first there is a APC presenting tissue antigen. So it is binding to the CD4 T cells, and this along with the presence of the CD8 T cells. So what they do is they release the cytokines. So they release cytokines, and these cytokines, it results in the inflammation, and then ultimately leads to the tissue injury. So to briefly explain it, the CD4 plus Th1 as well as the CD8 plus T cells, they respond to the tissue antigens. So they respond to the tissue antigens, and it secretes the cytokines. So as it secretes the cytokines, it leads to the inflammation and activation of the phagocytes. So it stimulates the inflammation as well as it activates the phagocytes. Activation of the phagocytes, it leads to the tissue injury. So this will be the delayed type hypersensitivity. This was the delayed type hypersensitivity. Next we will be looking at the T cell mediated cytolysis. T cell mediated cytolysis. So what does this include? So there is a CD8 plus cytolytic cells. So this will lead to the cell injury and the tissue injury. So in case of some diseases, in short, in some diseases, the CD8 plus cytotoxic T lymphocytes, they will directly kill tissues. They kill the tissues, cells, as well as the T mediated cell injury is seen.